So let's talk about flight nursing. Before I let you go here, when did you decide to make that? Like, how did that even become a thing? So I'm guessing that you guys are like a trauma one, because I don't know any hospitals that have flight nurses that, or do you work for an agency? Explain how you got into being a flight nurse and why you decided to do that. Because you're right, it's basically an ER and shit can't happen when you're in a helicopter. But like, I don't know. Before I let you, it's just when you think about flight nurses, like you watch television and stuff, and you just see like they basically glorified transporters is what I mean that in the most respectful way possible.
I take it in that way, in the most respectful way. Listen, we're just a bunch of dorks in a fancy suit with a super fancy Uber, right? I mean, we do have a lot of critical skills. We do have a lot of autonomy. That's the big difference, is it's me and a medic in the back of the helicopter making decisions about how to care for this patient. We're going to hang something. We're going to tweak a ventilator. We're going to intubate them. Those are decisions that we don't have a physician or a nurse practitioner telling us to do. We're making those decisions based on our guidelines. And so we're using our clinical judgment. That's the biggest difference. How
did you get into it? I'd like to know what that process was.
Yeah, it's a little bit like how I got into nursing. I just sort of float into things and look up and find myself like, how did I get here? So I was the educator in the department, and so that meant that I did all of the helipad training for our nurses when they were going to receive a patient from the flight crew. There's certain things you do on the helipad and certain things you don't for safety and etiquette. And so I would do that training with every staff member of the ER. And part of the end of my spiel was always, we have one of these companies that offers a third ride experience. If you want to go and do a fly along and just see what it's all about, they invite you to do that. And if you want to do it, I have the number of the guy, I can hook you up, whatever. And I realized several years into it, like, I've never done a third ride. Like, I don't even know what that's about. Like, maybe I should, I'm offering it to all these people. Maybe I should go find out what that is myself, first person. And so I set up a third ride, just like as part of the educator, whatever. And man, I was kind of hooked. I just was hooked. And so it wasn't long after that I applied, and here we are 5 years later.
So you can only, I don't know if you can speak for most flight nursing or like flight nurses, but does it work that you're based out of one hospital, or do you work in like a town, a city? Like, because I was always like, where is home base for these flight nurses? Like, or are they just everywhere all the time?
Right. So there are different programs, and they're both of those models that you talked about. There are hospital-based programs where the flight crew and the helicopter are based at the hospital, and they go out from there to go and pick up patients. And then there's what's called community-based programs, where you're actually out in a fairly rural community usually. That's what my program is. So my base is at an airport. And we have a hangar at the airport, and we've got, it kind of works like a fire station. We're there for 24 hours, and we have a kitchen, and the pilot has a bedroom, and the medic has a bedroom, and the nurse has a bedroom. We have a little living room and a gym, and we hang out. And then when we get a call, we go. That's awesome. And that's what we do.
And do you guys ever do, because this is just something I see in Grey's Anatomy all the time, but do you guys ever do, like, when there's like an organ donation, do you guys ever carry organs?
That would be super cool. I've never done that. But we do some other really cool things. Like, we do evacuations for the hurricanes when the hurricanes come. We've got I'm not a NASCAR fan personally, but we have one of the NASCAR racetracks is right in my backyard. It's actually where one of the places that our aircraft serves. And so we go and station there during the NASCAR race. And if there's an accident with one of the drivers or whatever, we would take them to the hospital. So that's in addition to just the regular stuff that we do. We do have these other opportunities where we do some kind of cool stuff. But no, I've never toted a heart.